I want to start with a brief land acknowledgement. Like so many of our institutions and homesteads, the I-29 corridor between USD Vermilion, USD's Health Sciences campus in Sioux Falls, and the South Dakota Humanities offices in Brookings got built within the ancestral territory of the Osheti-Shakowin, meaning 7 council fires, which is the proper name for the peoples whom settler colonial communities called Sioux. It is with profound respect that we acknowledge the indigenous peoples of this land. With pain and sorrow, we acknowledge the deep and lasting wounds these settlements have inflicted on those very same peoples and their descendants. As we learn and grow together here tonight, we place a premium on mutual respect so that we might avoid similar displacement, silencing, and other harms. My name is Pete Hazing. I direct the Medical Humanities program, which is new at the University of South Dakota Sanford School of Medicine. I'm joined this evening by my colleague at the DeGroat Center for Bioethics, Humanities, and Healing Arts, Ellie Schellinger, and by our colleagues in the Arts and Health program at USD, Ariadne Albright and Rebecca Freilich. We're also joined by the Dean of the Sanford School of Medicine, Tim Ridgway, and the Dean of Medical Student Education, Dr. Mark Beard. Thanks so much for joining us, everyone. This program has been made possible by the University of South Dakota Sanford School of Medicine and the South Dakota Humanities Council, an affiliate organization of the National Endowment for the Humanities. We're so grateful to the South Dakota Humanities Council board and staff, especially Melinda Berdanier and Ryan Woodward, who have offered excellent support as we prepared this virtual event. We also want to thank Dakota State University in Madison for hosting the webinar on their Zoom platform and providing additional pre-event support. Thanks, Tyler and Nolan. Thanks so much for all you guys do. I'll turn it over to Ellie for just a moment. Ellie, we've got to unmute you.
Oops, I thought I was doing so well.
There we go.
So, what are the humanities? The South Dakota Humanities Council celebrates literature, promotes civil conversation, and tells the stories that define our state. There are medical humanities or health humanities that embraces South Dakota's conversations and stories about people and medicine, narratives of illness and suffering, diagnosis, treatment, and well-being. Health and medical issues touch us all. According to the South Dakota Department of Labor and Regulation, nearly 60,000 Dakotans work in health professions. If we include health and hospital adjacent hospitality workers and other closely linked labor markets, that number is much larger. Even beyond those that actually work in the health fields, the National Alliance for Caregiving and the AARP showed in 2009 that more than 65 million Americans provide care for a chronically ill, disabled, or aged family member or friend during any given year, spending an average of 20 hours per week providing care for their loved one. That means that this kind of caregiving, according to statistics from Family Caregiver Association, impacts 1 in 4 Americans every year. This work takes its toll. 61% of those termed intense family caregivers, those providing at least 21 hours of care a week, have suffered from depression.
So that offers a frame for humanities in general, and maybe for medical humanities and health humanities in particular. Here's a bit more academic or dictionary definition for your consideration. Medical humanities is a multidisciplinary interprofessional field of inquiry, driven by the notion that health professionals treat humans, not mere bodies. We sometimes also call this health humanities. By interprofessional, we mean that it cuts across multiple fields of medicine and healthcare. So we're not just talking about doctors and nurses here, but also medical researchers, mental health professionals, allied health folks like radiologists and lab techs, all the folks who help make healthcare facility operations possible. We mentioned before the hospitality units and those kinds of folks, for example, and those who help health professionals think about the ethical and legal dimensions of healthcare and healthcare research.
Medical humanities are complex. Medical humanities employs the methods and resources of diverse bodies of knowledge, such as philosophy and theology, law, social sciences, history, languages, literature, and is informed by the critical, cultural, and historical dimensions of the arts. Medical humanists nurture interpersonal skills and help practitioners develop emotional intelligence and resilience. They strive to promote community engagement and provide insight into the experience and practice of medicine in modern healthcare. Similarly, both the student and the practitioner, the patient and the healer, reach to the medical humanities to help illuminate the individual experience of health, wellness, illness, vulnerability, and suffering.
So now to the current phase of our efforts to build a medical humanities track within the Sanford School of Medicine at the University of South Dakota. With support from the South Dakota Humanities Council and matching support from the Sanford School of Medicine, this project was designed to produce a draft asset map and a phase 1 needs assessment. So let's spend a few minutes demonstrating what those two things entail. By assets, we mean people, institutions, organizations, and other resources that, in theory, anyone with the time and interest in medical humanities could find and consult to inform the work they're doing. So we mentioned those folks across all those fields that Ellie was talking about. Virtually any of those folks ought to be able to use this asset map to find each other and to think through collaborative possibilities with each other. Mapping those assets out with specific geographic locators is one way to help people connect on the specific topic of medical humanities, and it's commonly an important component of strategic planning processes in lots of fields. We're just applying it here in medical humanities. Since we're beginning to build this medical humanities track within the Sanford School of Medicine, we wanted to begin that work by trying to visualize in our state geography in South Dakota all those people already doing work within medical humanities or directly relevant to medical humanities. So both of these things are statewide in scope. And I'll come back to the needs assessment part of this in just a minute. But for now, here's one part of what the asset mapping piece of this looks like. So one of our deliverables for this project is a draft map. And this is one layer of that mapping. One founding assumption of this work has been that there are already people doing things in South Dakota that could be construed as medical humanities. Based on some of our prior relationships and forming some educated guesses, we made similar assumptions for arts professionals working in or adjacent to healthcare. This conscientiously inclusive approach was influenced not only by medical school leadership, but also by folks doing things like creative writing. So creative writing is an interesting example. In one sense, it's a humanities field by definition. It's a huge part of what South Dakota Humanities Council does and what other state humanities councils do. In another, though, it's obviously also a creative field of practice. It fits in with the arts in that sense. So both aspects of something like creative writing can help illuminate what it means to be a healer or a patient. Both aspects can influence practitioners at the level of empathy and resilience. So we began with this notion that other fields of creative practice also have capacity to live in this fascinating space among the arts, humanities, and medical practice. To illustrate how this one layer of this mapping part of the project works, I'll ask our colleagues, Ariadne Albright and Rebecca Freilich, to talk a little bit more about their work with us on the arts layer. Their work supports our vision to align common interests across the Sanford School of Medicine, the USD School of Health Sciences, and the USD School of Fine Arts. Ari?
Thank you, Pete. It's great to be here. Again, my name's Ariadne Albright, and first and foremost, I'm a visual artist. I'm an owner of the business Creative Care here in Vermillion, South Dakota, and I've been working as an artist in healthcare and community settings for over a decade. And from that work, we've developed a certificate program at USD through the College of Fine Arts for arts and health professionals, in which I teach. Arts and health professionals include actors, visual artists, choreographers, writers, poets, dancers, musicians, even administrators. And unlike, we're not art therapists, but we do bring our art form into participatory art sessions with those that are in hospitals, long-term care, behavioral health settings, assisted living, to those that are incarcerated, adults of all abilities, veterans care. And so each time I speak about arts and health, it's important to note the overlap between art therapists who have a clinical component to their education and measurable outcomes, whereas artists working in these community and healthcare settings, we provide a positive distraction. We increase quality of life. Certainly with medical humanities, we teach things like self-care and care for the caregivers. So there's a tremendous amount of overlap. And in informal terms, I like to say that art therapists and the creative art therapists, they go deep, whereas arts and health professionals, we go broad. And so that way our community outreach can really have the highest impact. And I'm happy to be collaborating with Rebecca Freilich, a former student and now a colleague at Creative Care. And I'll turn it over to her as to how we approach this, this layer of data gathering. Thank you.
Thanks, Ari, and good evening, everybody. So as we were approaching this project, we began our search by drawing upon our own connections and knowledge of health-engaged arts professionals in South Dakota. So Ari mentioned some of those people, whether they're trained artists in healthcare, or if they are art therapists, music therapists, etc. We also did several keyword searches using narrative medicine, health humanities, and medical humanities with Midwest and South Dakota related keywords, which is how we found some of the professors already doing research in this field across different organizations in South Dakota. So what you're seeing on this map is by no means all of it. It is the representation of one layer of people who agreed they did want to be on the map and would be open to potential future collaboration, which is really exciting. So the people who you're seeing here are the ones who agreed they are interested in medical humanities as a field and they want to be called upon. And the other part of it that helped us gain information was that they shared the names of colleagues that might be interested or who they know do adjacent work. And so we were able to find people we never would have found otherwise. And with that, I'll hand it back to you, Pete, I believe.
Yeah, thanks so much, Rebecca and Ari. So with Rebecca and Ari's support on the arts layers, and thanks for emphasizing that aspect, Rebecca. Some of you here will be old enough to remember what it was like to lay transparencies one over another and see layers of things. In the finished interactive web-based resource that we're envisioning, we want people to be able to lay those different layers over each other and see collaborative possibilities that they might not have been able to envision or imagine before. We want them to be able to customize their interests. So in another layer, you can see here where a whole bunch of different things are checked. And in the next phase of this project, over the next year or so, the layers of that map will continue to develop toward this interactive web-based resource that users can customize according to their various interests. So for now, this kind of shows most of the arts interests that Rebecca and Ari have explored, along with a few other categories. But it's mostly arts layers. And you can see in the previous slide, so these are two different layers, that we're going to have different parts of the state geography represented on different layers, just depending on where and how people's interests live in the world. So right now on this layer, you can see that it's very sort of East River, West River, with some interest in the southern part of the state here. But I don't know if you can see this. I have trouble seeing the northern geography of the state under the other stuff that's on my screen. But on other layers, you may see a very different shape. And then when you superimpose that on, for example, our frontier and rural medicine sites, or state health education centers, we hope that people are going to be able to see some possibilities for building new curriculum, for collaboration at clinical sites, and for other kinds of things. And it's purposely sector and geography inclusive of all the kinds of folks that I mentioned before. So we want to thank our collaborator on this, our resident geospatial technical expert, Thomas Nello White, who's a graduate student at South Dakota State University. He's written these layers into a code that remains open to continuous updates, enrichment, and improvement. And that's really going to make, it's going to bring tremendous value beyond this project period that the Humanities Council has supported, because we'll be able to keep going later. Meanwhile, as we've made contact with all of these assets that are represented on this layer, we've also solicited their input on the needs assessment component of this project. So let's dig in a little bit to what we mean by that needs assessment. With Humanities Council support, we've made what we anticipate will be the first of multiple passes to understand people's work, what it presently requires, and what might enrich it and make it more sustainable. As we do that, we're also pointing folks to new resources that, thanks to our partners at Wagner Science Library, we have been able to not only sort of amass new resources, but curate existing resources. Ellie, do you want to talk a little bit about that component?
Yeah, where would we be without our libraries? The Wagner Health Sciences Center has been instrumental in providing library resource support for this project. They've developed a library guide specific to the health humanities. Libguides, as they're called, are a way to organize and showcase library resources and services, making them available to people interested in research and study. They are content management and information sharing systems that allow easy navigation through resources in a particular subject or field or class. Our medical health humanities LibGuide has been separated out of the medical education guide. It points to suggested resources that support an assignment or investigation into specific health humanities queries and expands the curriculum and/or interests of our medical students and faculty. The Wagner Health Sciences Center is also providing a system for collecting and curating student work for public viewing, which we're very excited about. Pete?
Thanks. Yeah, as Ellie was talking there, I just wanted to go to the web-based version of this, which is a bit more dynamic. and we'll continue to work with Wagner staff to enrich this resource on an ongoing basis. The curatorial element of that is relative to student work is one aspect of it, but as you can see from, for example, Pablo Picasso's Head of a Medical Student and other examples, there are also visual arts and other arts related resources and written word resources across all of these categories that are accessible through this one Libguide. So let me go back to so between this draft asset map, the first efforts at a needs assessment, the arts component, and the capacity we're building at Wagner Health Sciences Library, we think we're off to a good start in building a medical humanities track. We're about 6 months in, and we're really keenly interested in connecting that med humanities track across USD, so the School of Health Sciences, the School of Fine Arts, the School of Arts and Sciences, but also across the state of South Dakota. So what direct relevance does any of that hold for understanding or impacting patients, healers, and actual health outcomes? This image comes from a resource called Healthy People 2030 from the Office of Disease Prevention and Health Promotion, which is part of the US Department of Health and Human Services. Our colleagues in public health use the social determinants of health framework to think through those factors beyond the body that impact not only individual and community health, but also the capacity of our providers and systems to address health needs. We could talk about how anthropology, economics, history, sociology, and literature help us understand the various parts of this model. But one concrete intersection among all these domains tends to be the stories. Narratives and other depictions of illness and wellness, suffering and healing, affliction and human thriving. These are so often the stories that define our lives, our communities, our state, and as an ongoing global pandemic has so frequently demonstrated, our nation and our world. So we turn once again to you, South Dakota communities, to think with us about these stories. Let's hear your questions and reflections on the work we've discussed here this evening. And as you're pondering those questions, I want to mention that our post-event survey is here. We welcome you to tell us what you think in that context. If you're not comfortable telling us what you think right here and now, or if you think of other things later, that's perfectly fine. There's another way to do that. It may take some time to percolate things and to think about the asset map as we've presented it and about what your needs may be.
Yes, we're excited to hear what you're thinking, what kind of ideas this provokes. So we've reached that interactive portion. Please use the Q&A function to submit questions.
Rebecca, thanks for your question about getting a link to the survey in the chat. That link is now here and visible for everyone. Catherine Coda asks, what can each of us do to help the project? At this point, we're asking people to think about your health and healthcare stories and think about the kinds of health providers that you want to work with. What stories do you wish they knew? What experiences either here in South Dakota or that you've had elsewhere that you're bringing here to South Dakota might inform not only medical education, but interprofessional education as well. So a couple of other questions here showing up in the Q&A. Thanks, Ellen Donahue, music therapist at Avera Behavioral, and would love to be involved and learn more. We're well acquainted with Dr. Mark Vandebrack, who's also a music therapist over there. Ellen, I would love to touch base with you after. Thanks so much for your question. Heather Heminger, longtime nurse and nurse educator. Do you have plans to include neighboring communities in bordering states? What a great question. Heather's a nurse educator in Nebraska and a longtime friend. At this point, no, but I love that question. And I'm so glad that people want to include neighboring geographies in a project like this. That doesn't mean that we couldn't make plans to do that and collaborate with other institutions down the road. For the current phase of this project, we had to be pretty narrow in terms of South Dakota's geography because it was a South Dakota Humanities Council thing. But I fully plan to go to one of the Humanities Council's main funders, the National Endowment for the Humanities, for subsequent phases of the mapping component, especially as a digital humanities project. And I'm really glad to know in that regard that there are neighboring geographies who are interested in this. Thanks, Heather. Jesse Daw, thanks for your question. How can patients be invited in to share their stories? What a great question. Jesse runs the Eastern South Dakota Multiple Myeloma Support Group, and our stories connect us, she says, have created community for a group that have often never heard of myeloma when they're diagnosed. So this is a question that's directly relevant not only to that group, but also to other kinds of support groups for other afflictions. We envision as we carry this project forward that there will be not only opportunities for medical students to think about how they interact with groups like this in their clerkship and other clinical experiences, but also how we might begin to think about medical ethnographic research. So I'll just unpack that a little bit. That's my background is as an ethnographer of music and medicine, which is a $20 phrase for I like to write about people and illness and wellness and music. So down the line, I envision that some collaborations could emerge around research that would incorporate patient stories. When we started the medical humanities track, Dr. Beard was intent on kind of two components of that track. One is a curricular component that touches not only med humanities, but our collaborations with health sciences on interprofessional ed. The other is our scholarship pathways program, which is competitive for med students to get into and helps prepare them to be really excellent collaborators with existing physician researchers or at some stage down the line to become physician researchers themselves. So they often produce an early stage, some kind of publication or poster or research presentation that emerges from those projects. Any number of those things might usefully incorporate the kind of patient group that you're referring to, Jesse. So thanks for that question. Let's see. We're doing great on time. We're about halfway through the time we've allotted for this, and we've got more questions here. So thanks and keep them coming. Dean Ridgway and Dr. Beard, I see Dr. Ridgway showed up here in the Q&A. Would you like to say a word or two as I kind of process some more questions here? I can certainly unmute.
Oh, thanks, Pete, and thank you to all of our panelists for being here this evening and for all of the participants too. This is exciting, and I am just thrilled to have had the opportunity from the first moment I met Dr. Hazing, and as he's been helping us with this, and as he's been providing me updates along the way, it just is really invigorating to understand what we might be able to accomplish partnering with the South Dakota Humanities Council, our partners in and across the arts under our Board of Regents system and across the state, as we're looking at those opportunities to really help enhance what health professional education can provide for our students and our learners and our patients in respect of all of those different things. I love Dr. William Osler and some of his quotes. And that you hear so often the science of medicine, and then that's always followed with the importance of the art of medicine. And he has a quote where he says, the practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally with your head. And I think and I look at what we offer our students and how much more we can offer our students in partnering with the arts and the humanities to provide a more rounded, fully encompassing medical education. And I think when you look at this and consider what the medical humanities can and will accomplish, I think it will be both instrumental and non-instrumental in functions related to our medical school curriculum and our health sciences curriculum. Humanities can have an instrumental function when directly applied to the daily work of a health professional. For instance, I actually studied graphic art design and almost became an artist before I chose a career in medicine. And the study of visual arts can and has been used to improve the ability of a clinician to recognize visual clinical signs of disease in the patient. Similarly, literature and the study of literature has been used to train empathy and skills for handling ambiguity. And the evaluation of case study narratives can improve clinical skills. The humanities also have a non-instrumental function and lead to general education and personal development, or new ways of thinking beyond just the biomedical model and the biomedical perspective. So I'm incredibly excited for the opportunities that have been afforded with this conversation and what this will become, and just thrilled for the partnerships that are developing in this. So I don't know, Dr. Ridgway?
Just briefly, because Dr. Beard touched on things very well. He and I share a real passion for this work. We have incredible technologic advances in medicine. No one can dispute that. But it could be argued that I think to some degree, we've lost our humanity. I will constantly ask the public, what do they look for in a caregiver? And it's not just physicians, it's interdisciplinary, like you so eloquently pointed out, Dr. Hosing. They don't ask you where you ranked in your class. They don't ask you what you scored on your boards. What's important to them? That you care, that you see them as human beings. The humanities can offer so much in terms of observational skills, in terms of abilities to communicate, which we really suffer in the medical profession these days. And things in addition to what you mentioned, I'd love to see this program grow where we use music not only as therapy, but you look at jazz improvisation and how artists will on the bandstand communicate with each other non-verbally to create a beautiful masterpiece. The same thing can be done in medicine. And I would argue that we talk about the burnout rates of our healthcare providers, particularly in the COVID age. This is another way to all of us who are caring for individuals that purpose. So just looking extremely forward to working with all of you so that this program can grow and grow, because I think it's limitless. And I thank all of you for your commitment to it tonight. And to everybody that's watching, good for you. You have an interest. This is great. So we look forward to working with all of you.
Thanks so much, Dr. Beard, Dr. Ridgway. Thanks for being here, for your hearty support of not only this grant-funded program, but the whole initiative. That we've felt that support very consistently at every step of the way. So other questions and comments, folks? Please, even if it's not tonight, consider telling us your story, and not just of illness or recovery or overcoming, but also who are the exemplary community health leaders that you see in your communities? What collaborations do you think are really notable that could have an impact on provider education in some way or another? Maybe there are systemic failures or adjustments to systems that were failing that really worked well. South Dakota is a fascinating cultural space. I live in Sioux Falls. It gets more culturally diverse seemingly every week, definitely every year. It's a whole lot more culturally diverse place than when I left the Midwest to study in the Southeast part of the United States. And I came back to a very different Midwest. And so you may know about aspects of your individual or community health that are connected to arts and culture that might have some relevance to this project. And likewise, we want to continue to hear from folks, the kinds of folks that Ari and Rebecca have already reached many of, who are working with arts-based methods and experiences that impact patients, providers, and communities. I know we have a couple of public health folks here. We are in frequent discourse with one colleague who's both in our School of Public Health that cuts across USD and SDSU, and she's an associate dean for equity, diversity, and inclusion in the medical school. But other public health folks, I don't think we're through examining where our purposes might be aligned. We use the social determinants model because it's a really useful framework to think about health and society. But it seems to me there's a lot more work ahead in terms of alignment between medical humanities or health humanities and public health. We had a barrage of questions at first, but I dare say people are tired and ready to move on with their day, which is just fine. Thanks so much for joining us this evening. We hope you'll stay in touch with us. This group of folks who are panelists this evening are listed here, but it's not at all difficult to reach any of us at the Sanford School of Medicine. My email address is there. The QR code for the post-event survey is there. And that's also in the chat if you would like to follow up. So with that, I think I'll get people on to whatever else they have planned for their evenings. Thank you so much for joining us for shaping medical humanities in South Dakota. Thanks again to the University of South Dakota Sanford School of Medicine and the South Dakota Humanities Council. And thanks to Dakota State University for hosting this on their Zoom platform. Take care, everyone. Have a good night.